Hi everyone, Dan Julien here, nurse practitioner for Danesthetics Medical, and today we're focusing on neuromodulators around the nose. Now, believe it or not, there are a lot of off-label treatments for around the nose, including bunny lines, flaring of the nostrils, lifting the tip, rosacea treatments, even spider veins. We're going to cover all of them, and at the end, I'm also going to let you know the ones that I don't really feel are that effective based on personal experience. Stay to the end. Let's get into it. All right, let's get into it. Let's treat the bunny lines. These bunny lines are attributed to either one muscle or a group of muscles. The main muscle is going to be the nasalis, the transverse nasalis, this muscle right here. And I really want you to pay attention to the location on the bridge of the nose. And when I'm doing this motion right here, notice where the wrinkles are? Well, that muscle group right here is actually a little lower than those lines. It's actually right here. And often enough, providers will mistake in trying to place neuromodulator directly into the wrinkle, hoping that it's going to treat it. And it doesn't usually do a darn thing, or it doesn't do a great job. And the reason why is because they're missing most of the muscle. The muscle is a little bit lower. You need to place the product right here on the sides of the bridge. 2 to 4 units per side usually does the trick. And let's take a peek. So notice me pushing up here with my squinting, goes down. And then if I do this, and I hold it, notice how much of an improvement that is. Now, here's Stuart. This is where I would place my products, right here and right here. Now notice the other orange X's around it. These are known as your compensatory muscle groups that also attribute to this bunny line expression. Take a look at her picture here. Look at all the muscles that are being involved just to cause that. She has her procerus, which is this muscle that's being pulled down. And she also has this LL-SAN muscle on both sides, which are aliquinosi muscles that pull up whenever you're making that movement. And they are all attributing to these lines. So what you can try doing with new clients is just try doing the nasalis muscles first. But if they come back after 2 weeks and like, listen, didn't really do too much, or you're not getting the results you're hoping for, what you can do is also place maybe 1 unit right here, 1 unit right here, and then making sure that you definitely want to attack that procerus muscle just to make sure all those muscle groups have been addressed. Now let's treat the nasal flaring, which is this aspect of the muscle right here and right here. And this is actually called the alar aspect of the nasalis muscle. It's still the same muscle as the transverse, it's just extending down further. And once it gets down here, this is now called the alar portion. And it's responsible for the flaring of the nostrils. Now, some people really don't like the flaring because it tends to wind their nose. They tend to flare it excessively, especially when they smile. So this is a really nice trick in order to give the impression that it's slightly narrower. And the way to do that is place no more than usually 2 units per side. Let's bring in Stuart here and I'll show you. You can place it a little higher if you like, or you can place it a tad lower. Remember, if it's a tad higher, you might miss a little bit of the lower aspect, but if it's a tad lower, then it might spread and it might hit that aliquinosi muscle. And also, you definitely want to be intradermal. If you go deeper than that, which can be tricky sometimes, you might miss the muscle altogether. Next up, lifting the tip of the nose with a little bit of neuromodulator. And if you're someone that would like to have a little bit of lift, this will work for pretty much everyone. And let's get into the reason why. First of all, this muscle group underneath here is called the depressor septi nasi muscle. And this is exactly where I place my neuromodulator. Right here, 5 units, boom, goes in, and it's going to relax that muscle. Now, the 2 main groups that benefit from this are going to be group number 1, when they smile, they may get a little bit of a line right here, and the nose dips forward. That's a key signal and marker for letting us know that they have a tight depressor septi nasi muscle. So they'll definitely benefit from that, and they'll notice a nice little relaxation and a little lift. Now the other group, which applies to pretty much everyone, we all notice that as we mature, our noses tend to dip forward a little bit. And the main reason for that is because this is all cartilage and muscle. Underneath that, there's a hole in the skull there, and that hole tends to open up and protrude in on itself. And as that happens, everything gets deeper and things tend to kind of move forward. As a result, if you want to treat that, yes, dermal filler can prop that up, but a nice little trick as well is to place a little bit of neuromodulator right there, and that's also going to help relax and kick up the nose. Now, I've noticed on social media recently that there have been claims where providers state that if you place neuromodulators in the tip of the nose here, it can help lift the tip and also maybe narrow it. And in my opinion, that is complete garbage. That's not going to do anything. The reason why someone has a wide tip is because of the cartilage. Placing any neuromodulator here is not going to have an effect on either of those things. Maybe microscopically, but it's nothing visible, that's for certain. Narrowing the nose, the only way is by hitting the alar on the sides and lifting the tip. You'll only get that improvement by placing it at the base here. So I make it a point to attend international medical aesthetics conferences annually, and often enough there's a discussion about neuromodulators treating rosacea and spider veins. So this year, I made a point to try it on 12 different clients and more than once on a couple of these clients. And to be honest, the results have been not so great. Most of them, I haven't really noticed any results, and some of them, maybe mild results. And the idea is to place hyperdiluted neuromodulators, so a 4:1 ratio, and you're placing it very superficially, maybe 5 to up to 10 units surrounding the entire nose, depending how severe it is, and it's supposed to soften these dilated blood vessels. Again, in my opinion, it doesn't really do too much. Up to you if you want to try it out. So that's it for me today, guys. Stay tuned for the next one. You're not going to want to miss it because we are talking about the mouth, how to address barcode lines, also known as smoker's lines, a lip flip. We're also going to be talking about how to lift the corners of the mouth to turn that frown upside down. Until the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Take care.